My dad had a stroke. We noticed when he had it, he was saying that he felt like he didn't have no arms. I said, you done had a stroke.
Had a surgery in November of 2022, and some things went wrong, and it kept me in bed on bed rest for multiple months, getting much weaker.
Your request was denied. We've denied the medical service requested by you or your doctor or provider. We denied the medical services items based on Medicare guidelines. The inpatient rehabilitation services requested do not meet the requirements for approval.
Already being sick, and then you get the runaround from these companies, it makes it even harder.
It was a delay because the insurance had to be accepted.
Particularly since COVID, we've seen a great deal of denials for Medicare Advantage insurance companies. This is specifically for acute inpatient rehab.
And what ends up happening is individuals who are in the hospitals end up spending 5, 10, 15 days not getting approved and thus missing out on therapy that's necessary for them to improve their functional and medical needs.
Every day that I was in the hospital, I was just getting weaker. Those 2 or 3 week extra that it took just really played on my body even more.
If you're looking at, a few months or a year of that window to maximize your recovery, you want to be in therapy as much as you can and not have to wait for a delay or wait for a month or two to get back in.
Every day lost may lead to decreased muscle mass, decreased endurance, which affects their recovery.
What most people don't realize is this is actually care denial. So it's before there's any type of payment. It's the care that would be expected to be given if you had Medicare. And that process, unfortunately, is very challenging for hospitals to navigate.
When patients are upset about their insurance coverage, it really impacts how engaged they are in therapy sessions, because if in the back of their mind they're always thinking, well, is this therapy covered? So it really impacts here how often they want to come in and really how invested they want to be with the stress of getting to therapy on a regular basis. So I think having a peace of mind where you know your insurance is covering your therapy is super important.
It does make you more angry, and it does, sometimes you don't know who to be angry at. And so I understand that it's not the doctors and it's not the therapists, but some families may jumble this all together, and so now are they having as much confidence in their healthcare providers as they could have had if this process had been smoother?
When I can focus on just getting better and just getting stronger, it all around makes me feel better, and it makes life easier on those around me.
And so what we did is we just created, after researching the regulations, researching the appeal letters, we put everything into a one-page fax just to hit the button to say you got this wrong and take another look back to the plan. The plan then is obligated to give you a response to your appeal within 72 hours. And it took me 2 years of actually getting in and doing this work to help figure it out with our great team here at Atrium.
It was so exciting to hear what Dr. Moore had done, and he really put in the research and the work. We all go into healthcare for one reason, to help patients. And so that's what Dr. Moore has done for us at different locations through the Atrium Health umbrella. He's been able to say, try this approach, do this in this period of time. Who doesn't want an outline? Who doesn't want some guidance and showing us how we can do things better?
The secret sauce is an evolving sauce. Universally, what I hear from the institutions, the physicians, the hospitals that I teach this to, is when they start doing it, they get phone calls and they get significant pressure that what they're doing is wrong. And I can tell you for sure it's not wrong.
The challenge is that as an individual is trying to recover from a devastating illness or a catastrophic injury, they don't have the bandwidth to have to worry about whether the care that they're going to receive after their hospitalization is appropriate. They should be entitled to that care, especially if other healthcare professionals are stating that they need this level of care.
Patients should not be held hostage in the middle of this discussion. And I think we actually have some solutions that might help with that.
He started getting better real fast. He's moving better, he's talking better.
Anytime you can have an advocate for you, it made a big difference, I believe, in being able to get over here eventually.
I've always felt very proud to work at Atrium Health because I feel like we do the best we can to support our community in a fiscally responsible way, putting their healthcare needs first.
So to know that we can now make a difference and that we can stand up with the facts, with the numbers, and say, this is not fair. I always believe in doing the right thing for the right person at the right time. I know what a difference makes. And so I'm so excited to be a part of this and to be part of the Atrium team.
I'm just very thankful for the care I've received here and the people more than anything.
Yeah, I just want to thank God for the care for him and let these people do for my dad. It's wonderful, you know, and he's done got back up just like that.